Diagnosis and prevention of diabetes mellitus. Diabetes mellitus is characterized by recurrent or persistent high blood sugar, and is diagnosed by demonstrating any one of the following. Fasting plasma glucose level greater than or equal to 7.0 mol/L, 126 mg/dL. Plasma glucose greater than or equal to 11.1 mol/L, 200 mg/dL, 2 hours after a 75 grams oral glucose load as in a glucose tolerance test. Symptoms of high blood sugar and casual plasma glucose greater than or equal to 11.1 mol/L, 200 mg/dL. Glycated hemoglobin, HbA1c, greater than or equal to 48 mol/mol, greater than or equal to 6.5 DCCT%. A positive result, in the absence of unequivocal high blood sugar, should be confirmed by a repeat of any of the above methods on a different day. It is preferable to measure a fasting glucose level because of the ease of measurement and the considerable time commitment of formal glucose tolerance testing, which takes 2 hours to complete and offers no prognostic advantage over the fasting test. According to the current definition, 2 fasting glucose measurements above 126 mg/dL, 7.0 mol/L, is considered diagnostic for diabetes mellitus. Per the World Health Organization, people with fasting glucose levels from 6.1 to 6.9 mol/L, 110 to 125 mg/dL, are considered to have impaired fasting glucose. People with plasma glucose at or above 7.8 mol/L, 140 mg/dL, but not over 11.1 mol/L, 200 mg/dL, 2 hours after a 75 grams oral glucose load are considered to have impaired glucose tolerance. Of these two pre-diabetic states, the latter in particular is a major risk factor for progression to full-blown diabetes mellitus, as well as cardiovascular disease. The American Diabetes Association since 2003 uses a slightly different range for impaired fasting glucose of 5.6 to 6.9 mol/L, 100 to 125 mg/dL. Glycated hemoglobin is better than fasting glucose for determining risks of cardiovascular disease and death from any cause. Prevention. There is no known preventive measure for type 1 diabetes. Type 2 diabetes, which accounts for 85 to 90% of all cases, can often be prevented or delayed by maintaining a normal body weight, engaging in physical exercise, and consuming a healthful diet. Higher levels of physical activity, more than 90 minutes per day, reduce the risk of diabetes by 28%. Dietary changes known to be effective in helping to prevent diabetes include maintaining a diet rich in whole grains and fiber, and choosing good fats, such as the polyunsaturated fats found in nuts, vegetable oils, and fish. Limiting sugary beverages and eating less red meat and other sources of saturated fat can also help prevent diabetes. Tobacco smoking is also associated with an increased risk of diabetes and its complications, so smoking cessation can be an important preventive measure as well. The relationship between type 2 diabetes and the main modifiable risk factors, excess weight, unhealthy diet, physical inactivity, and tobacco use, is similar in all regions of the world. There is growing evidence that the underlying determinants of diabetes are a reflection of the major forces driving social, economic, and cultural change: globalization, urbanization, population aging, and the general health policy environment.